Good evening and welcome, Professor Roger.
Thank you very much.
It is a privilege for me to host you here at the Armed Forces Veterinary Hospital. First of all, may you introduce yourself to the audience?
Yes, so I'm Professor Roger Smith from the Royal Veterinary College, which is the largest veterinary school in the UK, based in London, and according to the world rankings, the best veterinary school in the world.
Oh, this is amazing, and it's a privilege for me to have this opportunity to speak with you today about the training course that is held right now at the Armed Forces Veterinary Hospital. Would the first year student, the freshman, attend something like this, or the last year senior student, or the grad one who attend a training course like this?
So
What's your advice?
Yeah, this course, of course, is focused mainly on the more advanced practitioners, but training can take place at any sort of level. And certainly I run a lot of courses and teach on a lot of courses where we vary the level. So for younger vets and for students, you may want to focus more on the basics, whereas vets become more experienced and they want more advanced techniques and little tips and tricks that you learn as a clinician that isn't always in the textbook. So that's what we try.
What do you think about the attendees of this training course in comparison with different attendees all over the world? If you make a comparison.
So the delegates here have been really good because they're interactive. They ask me questions. I can tell from the questions that they are knowledgeable about the subject area, and that's really good. And the questions have indicated that they have a considerable amount of experience. So that's been really rewarding because now you can delve into some of the more complex issues that we encounter in horses in orthopaedics.
Is it your first visit to Egypt?
Yes, it's my very first visit. I have never been to Egypt before, so that was part of the attraction of coming here to visit.
What do you think about the facility, organization at the Armed Forces Veterinary Hospital when we are holding a training course like this? What is your impression about that?
Yes, so I knew very little before I arrived, and it was really interesting to learn the interaction there is between the armed forces and the wider veterinary community, and also the university teaching that goes on. And I think this is really nice. The facilities that we've had has been great. And I think it's really impressive how the interaction, it's much closer between the armed forces and the academic and the professional industry of veterinary medicine than I see in other countries. So that's an interesting difference.
As being a university professor at Cairo University, we have a collaboration with the Armed Forces Veterinary Department, including different facilities, the Armed Forces Veterinary Hospital, and we have different hospitals, not only this one in Nasr City, but we have another one in Mahadi, and we have the building capacity to train different level of student as well as grads, veterinarians. So regarding to the hand-on training, it is a little bit difficult for providing the material, the facility. What's your impression about the facility right here at the AFVH?
Yeah, so it's always a positive thing to be able to add some practical training. Just listening to people, including me, lecturing for long periods of time can be a little bit tedious and you get overloaded with knowledge. So part of the knowledge, you need to understand the knowledge, but part of it is the practical application of that knowledge. And so here with the facilities that we've had to do some practical classes in terms of needle injection sites in cadaver limbs, looking at lameness in horses trotting up, and also we ultimately do some scanning, ultrasound scanning of the areas. These are practical skills that every vet really needs to master, and it's a good opportunity to have an environment where you can have that support to guide people into how they can improve their technique and get better diagnoses, I suppose.
Diagnoses the gap between a country like Egypt and Europe in the field of veterinary education. What do you think? What is the gap that you may give us insight about it?
Yeah, I mean, there's not a major difference. I think the big difference is the complexity of the facilities that we have at the RVC. We have a hospital that has MRI, we have CT, we have a lot of advanced technology, which is really useful for some of the more complex cases we see. But we mustn't lose sight of the real basics, like using your eyes, using your fingers, using some of the more basic diagnostic equipment. And that's really what I focus on a lot of this training. So there is a difference in terms of how much equipment that we have available to us, but the basic skills are still the same. And so they're applicable here as they are in the UK.
I have went through your CV. I find astonishing research work that you did in regard with tendon research, regenerative medicine. Would you please give us insight about the translational medicine that you carried on, which may help as the medical field as well?
Yeah, so I got interested in research very early on in my career. I did a research project when I was an undergraduate, and I found that really interesting. I came to the Royal Veterinary College to train as a surgeon, and that the clinical work is still my main focus. But during that time, you understand the process of disease a little bit better, and then you have lots of questions, and some of those questions have not been answered. And so the ability to formulate a research program that answers some of those questions, sometimes they're very narrow questions and very specific research. Other times it's a bit broader, both on the clinical side and then lab-based research. And I've continued to have that as a sort of parallel running activity with my clinical work. And so it's that combination of research and clinical practice that I feel I can contribute in terms of making the research particularly relevant to clinical practice. And because the horse is very, very similar to the human in many of the diseases, we can use the horse as a model for the human. So I have also a lot of collaborations on the human side to look at that sort of One Health concept, which is also a very strong emphasis in Egypt as well, in the university and also in the armed forces.
Do you think that the stem cell research, as well as BRB therapy, the cell-free therapy that had happened in the field of tendon regeneration, is applicable right now all over the world and can be a part of your therapy protocol?
Yeah, so we started looking at regenerative therapies back in the early 2000s, and we very much focused on stem cells. And we did a lot of work, so 20 years work looking at stem cells. But there are problems with stem cells in the way that they are difficult to produce, they're expensive to produce, and as a result, they often outside the normal range of somebody's finances to treat their animals. So we've always been interested in making that system a little bit more practical, and the next step will be understanding a little bit more about what the cells do within the tissue, because we have good evidence that they are beneficial. They don't necessarily regenerate the tissue, but they have beneficial effects on the repair. And so the next stage, which is using cell-free preparations, using the understanding of what the cells are producing, and the exosomes being one example of that, is a logical next step. So that's a really exciting next step to make the treatments more affordable, more practical, and so more able to reach more and more patients, basically.
Have you visited the Grand Egyptian Museum?
Not yet. I've been working very hard on the course all day as the sole speaker, so I have not had time, but I believe we're going there this evening, so I'm looking forward to that.
Actually, it's amazing, you know. Egypt right now is focusing so much about the equine medicine and surgery. And we are building up veterinarians focusing on sport medicine. Egypt has one of the most important races in the field of breeding of horses. Have you heard about the Egyptian strain?
No, I mean, I'm very much a specialist in orthopaedics. So when it comes to breeding, it's a bit outside my comfort zone. So yes, no, I need to learn more about that.
You are focusing on the most important thing in horses itself, because we have learned that the forelimbs of the horse is the most important thing in the horse. Do you think that the ability to establish a horse stable as well as horse hospital, because we're focusing right now to establish this kind of specified hospitals in Egypt, it needs a lot of finance as well as expertise. The expertise in the field of equine medicine is not built up within a year. It needs long-term strategy to have veterinarians in this field. So what is your advice for the one who is responsible for this, strategy in Egypt? Would you please give him insightful advice?
I think it's a difficult one, but I would say always that education is the most important currency for that. So ability to bring forward young enthusiastic veterinarians to engage with that educational process and to continue it after they've qualified. So the provision of an opportunity to learn throughout their lives and develop their careers, I think is very important, probably the most important. It's also good, however, to have good facilities, because the technology side of veterinary medicine has completely changed over recent years. It's our abilities now to investigate and treat conditions, just like in human medicine, has expanded in an extraordinary fashion. And I think we need to keep pace with that as well, as much as possible. But there are always cost limitations. Things become very expensive to add all the different complex equipment.
That's why Egypt have established what's called right now the Egyptian Health Council, and veterinary medicine is belonging to this council, the EHC. The continued education is a part of the process of the Egyptian Health Council right now. Every single grad has to develop himself, attend a lot of conferences, training courses, and this one is certified by the EHC. The EHC is monitoring everything in this training, and the certification itself is accredited by the EHC. I'm so much pleasure. I have, a special privilege to be with the most famous professor in this field, and I'm inviting you to come once more again to the AFVH, and I'm certain the next visit to Egypt, you will find something new, because in AFVH, you find every year a new technology, facility, and thank you for your collaboration.
Pleasure. Nice to speak to you.
Very nice for me to have you here, hosting you here. Thank you.